happy that I can give you this particular talk for feet and diabetes. So let's start. First of all, it's really important to mention about the human foot, which is a masterpiece of engineering and work of art, according to Leonardo da Vinci. The foot consists of 26 bones, 33 joints, 107 ligaments, and 19 muscles. We can definitely say that it's a quite complicated piece of organ that is part of our body, and nevertheless, it's the base of our body, so we should not take it for granted. Feet. They walk, they run, they skip, they jump, they kick, they dance. They are two of the most important things we have, and they belong together. We use our feet every day without even thinking about them. And the worst that might happen is when you stub your big toe against the door, or you develop a blister, or sometimes you cut it in the wrong way, and you don't really realize that there is a problem. However, if there is diabetes, forgetting about your feet can be quite life-changing because it is the #1 cause of below-knee amputations in the UK. If you have diabetes, you are 30 times more likely to lead to an amputation. Accidents need immediate attention, and as we know, diabetes is a lifelong condition which can develop foot problems. How that can happen? Diabetes is like a silent enemy. You don't really feel pain. It doesn't give you sometimes any triggers or any signs, but it can affect the feeling in your feet, the sensation, as we call it, that is called neuropathy, or it can affect the blood vessels, the arteries, which can affect the blood circulation, and it's called ischemia. Therefore, if anything is left untreated, it might lead to amputation. Every year, thousands of people have to come into terms of losing a part of their body from diabetes. This week alone, there will be more than 100 diabetes-related amputations in England. And not only that, 80% of those patients or more are likely to die within the next 5 years. So we need to stop that. We want to reduce unnecessary amputations. We want to put our feet first. 4 out of 5 amputations can be prevented. We need feet to stay together, to walk, to skip, to run, to kick and dance. We have to bring an end to pain and fear suffered by thousands of people with diabetes. How we can do that? It's really important once a year when you visit your GP to assess your feet, and how that can be done by taking a full medical history, see what's going on, what kind of medication you're taking, how's your diabetes, did you have any recent blood tests, do you walk at all, how's your social factors, do you have any problems with your blood circulation, or how's the sensation in your feet, what type of shoes do you wear, and how's your eyes? So there is like a traffic light risk guide, as we call it, and it's down to low, which is green, amber, which is moderate, and red, which is high risk. And I will explain everything further down. So what we do when we first see our patients as they're newly diagnosed, and that is, as again, what the GPs do, is to check the sensation. Monofilaments, as you can see, it's a very fine, it's not a needle, it just checks the sensation under your foot. So what we ask the patients is just to sit on the couch and to take off the shoes and the socks. And at the same time, we test under the feet how many sides they can feel. We ask them to close their eyes, and then we check which part of the body they can feel or they cannot feel the monofilaments. It's like a very fine, thin thread. The other assessment that we do is a vibration. It's really important to check if the patient can feel any vibration on the middle aspect of the foot or the big toe. That is another type of assessment to differentiate how the nerves react to trigger. The next one is if we can feel the pulses. So there are two pulses on the feet, one on the dorsal of the foot and the other one on the medial aspect behind the ankle joint. So it's really important to be able to palpate them with our hands. If not, then we use the Doppler device. The Doppler device is like a machine that we can hear the blood circulation, how it flows. If it's like 3 beats, which is the healthy one, if it's 2 beats or 1 beat, if it's like weak or if it's strong, if it's like it sounds like a train or whooshing. So different sound of the wavelength of the blood circulation can indicate if there is any problem with the blood circulation. So again, and I repeat that, it's really important those tests to be performed by the GP once a year or by a podiatrist or a healthcare assistant. Very important is to check your feet. How is the shape of your foot? Is there any redness, any hard skin, any pain in any particular areas? Do you have very flat feet or do you have a high arch foot? It doesn't always mean that there's something wrong, but according to the shape of your foot, you can choose accordingly what would be the best type of footwear. Calluses and corns. Please do not treat them with any corn plasters. It's really dangerous. Corn plasters, especially the ones that they have an ointment in the center, can really burn the skin. And I'll show you a particular case later that how badly things can go. So if you have corns or calluses, use a pumice stone, use a foot file it down and use a moisturizing cream. Moisturizing cream, not between the toes, because that's how you develop athlete's foot. But the moisturizing cream is applied under the plant on the dorsum of the foot and under the soles of the feet, not between the toes. In cases like that, you can visit a podiatrist for further treatment. Always check between the toes. If you see flaky skin, white, sometimes it might give you a bit of a smell. Or if it is itchy, then you have to consider it could be a sign of athlete's foot or fungal infection. In that case, you can always buy something over the counter, ask your pharmacist, or visit a GP or visit a podiatrist in your area. Toenails, another thing, very, very important. Sometimes it's really important to check the color of the nails. Is it red? Is it thick? It's yellow, green, black. What is the color? Is it very, are they very long? Sometimes long nails or thick nails doesn't always mean that there's something wrong. But again, they need treatment. Keep the nails trimmed, short, not too short, don't go too deep. Always what we recommend is use nail clippers. You cut the nails straight in the middle and round. Do not dig on the sides and use a metal file to make the sides round. Please do not dig the sides unless it's really necessary or seek professional advice from a podiatrist. Cracks. Very important to moisturize your skin, and that is not for aesthetical reasons. The reason why is once the skin is dry, it can break down very easily. If you have lack of sensation, and sometimes we don't know if people have lack of sensation, they don't realize it on time, it can be a very good source for bugs to penetrate and can lead to infection. So by keeping your skin moisturized, it means you keep it elastic, flexible, because when the skin is dry, it breaks down very quickly. So drink water and moisturize your skin on a daily basis. As we discussed before, the risk stratification is the low risk, the patient, the green ones, there is no risk, so you can still receive your annual foot checkup from your GP or podiatrist, and just to see how your feet are every year. The moderate risk is when there is one factor, such as if there is problems with your sensation or neuropathy, or if there's any blood circulation issues, or if you have any problems with your eyes. Again, annual eye checkup screening is very, very important. The high risk is when you have to, like, there's a combination of other factors that, because of the reduced sensation or the lack of circulation, can lead to infections and to ulcers because you don't realize what's going on your feet. And in that case, you have to be seen regularly by a podiatrist or a diabetes specialist podiatrist, and to be closely monitored by your GP as well. 6 to 7 out of 10 patients will develop lack of sensation once they're diagnosed within the first 5 years. And many people think that I have good sensation, and that happened in the clinic. That patient arrived with a pin, was stuck under the sole of his foot. Once he removed the shoe, there was blood everywhere. He couldn't feel it. So please don't take it for granted. It's really important, once you're diagnosed, to have good education to prevent things. The picture on the left is when a patient tried to cut his toenail because it was ingrown toenail. He left a spike, he had poor blood circulation, and within some days it ended up black. That toe is the beginning of gangrene. On the right-hand side is a patient who used 2 corn plasters. He forgotten that he had the corn plasters. He left them for more than a week, and he realized from the smell of the ulcers, because he couldn't feel it and he didn't know that he could not feel it, that those corn plasters, they burned the skin. Not only the corns, but they burned the skin on both of his feet. So what I'm trying to highlight is, don't take it for granted. Again, we want to prevent, we don't want to cure. Dry scabs, that might look dry and it might not look like there's anything alarming, but the redness on the dorsum of the foot, it shows that there is infection there, there is swelling, even though the wound, it doesn't look as bad, but that foot needs to be admitted in hospital because it's clearly there is a blockage. There is a poor blood circulation. So again, please check your feet every day. If you have a small cut or any problems, use a dry plaster. Then consult, speak to someone, speak to your GP, speak to your podiatrist, speak to your nurse. Any color change of your skin, red, black, purple, it's not good. So if you notice any abnormal and color changes, consult your GP. People will think that which has happened, and the reason that I'm showing you these pictures because again, if there is lack of sensation and you don't know, and you develop one foot hot, swollen, and one foot is more than the other, it doesn't mean it's water retention. Even GPs can misdiagnose that. It could be gout, it could be fracture, but it could be Charcot. So if one foot is bigger than the other, it's hot and red and swollen, that needs, you have to seek advice straight away because there's something wrong and it's not water retention. Always we check the temperature, and if there is any difference between the 2 feet, then it's an alarming sign that there's something not, gives us, it could be infection, it could be fracture, but there is something that's not right. I would like just to mention something very quickly about the people who are on dialysis. It's really important because we have major reduction in amputations. We see that very often, and that's a very typical necrotic gangrenous toe, which can happen within a week, maybe less. So, very important, the shoes should fit comfortably. Avoid any poor fitting shoes. Do not buy shoes in order to stretch, to change, to become bigger. Shoes should not fit like a glove when you buy them. Shoes should be comfortable from the minute you wear them, straight away. So you have to choose the correct size of your feet, the width, and the depth in the toes, in the toe box. So it's 3 dimensions. They should have good soles, rubber soles or something to support your feet, not thin, rigid. And ideally, we avoid slip-on shoes. We want laces or Velcros. You can adjust the width. Soft materials, leather. Avoid stitching around the toes because sometimes that can lead to corns. So make sure it's the correct size and all dimensions have been considered. Please think about trainers, especially now. We need to go to walk, we need to go out. It's part of the diabetes management, at least 30 minutes a day. Once you have comfortable shoes, it makes you feel happier. As we say, if you have a toothache or footache, it ruins your day. So comfortable shoes are more than essential. That is a very typical high arch foot, and sometimes a slip-on shoe, it's not recommended. You will end up with problems. Therefore, anything with laces, anything with Velcro would fit that particular type of feet. There are so many leaflets around for diabetes. You can find them in many GP practices, podiatry clinics, anywhere. Also online, the Diabetes UK, it's very, very good. So the last bit is that I would like to highlight that every 20 seconds a lower limb is lost due to diabetes. The cost to heal a diabetic foot ulcer is between 3 minutes to 6 years salary. Diabetes is the #1 and most common chronic disease in the UK. By 2025, it is estimated that more than 5 million people in the UK will have diabetes. A report published in 2012 by NHS Diabetes estimated that around 650 million, or £1 in every 150, the NHS is spent on foot ulcers or amputations each year. It's massive. That's why prevention is more than important. That's all.